Think carefully about this for a moment. Somewhere in your kitchen right now, maybe inside a pantry cabinet or resting on a shelf above the stove, there is a product you have probably consumed for years, perhaps even for decades. It may have been part of your childhood meals, something your parents bought regularly, something that has appeared on nearly every grocery list you have ever made. What many adults over the age of 55 do not realize is that this familiar item may be slowly damaging two organs that rarely complain. These organs work quietly. They do not send strong warning signs. And when symptoms finally appear, the injury is often already severe. Research in preventive medicine has revealed a deeply troubling pattern. Physicians around the world continue seeing the same story unfold. Retirees, grandparents, active older adults full of energy suddenly discover alarming laboratory results. Most are stunned because nothing seemed obviously wrong beforehand. No major pain, no dramatic symptoms. Then suddenly, the reality becomes impossible to ignore. The information ahead comes directly from clinical evidence explained in simple language, not medical jargon. Understanding this may become one of the most important health discussions you hear all year. Before revealing what may be hiding in that kitchen cabinet, it is essential to understand why the kidneys deserve far more attention than they usually receive. Most people focus on the heart. They monitor cholesterol. They check blood pressure. Yet the kidneys are often overlooked completely until serious problems appear. Imagine a cleaning crew operating inside the body every hour of every day, without interruption. No breaks, no holidays, no time off. That system processes roughly 200 liters of blood daily, removing waste products, toxins, and extra fluid. At the same time, the kidneys help control blood pressure. They balance electrolytes. They activate vitamin D to support bone health. They also help signal the production of red blood cells, so the body maintains energy instead of slipping into constant exhaustion. What makes these organs remarkable is also what makes them dangerous to ignore. They perform all this work almost silently. Unlike joints or muscles, the kidneys do not usually create sharp pain signals. A person can lose as much as 60 to 70% of kidney function and still believe everything is normal. Maybe there is mild fatigue, slight ankle swelling, a little brain fog, nothing dramatic enough to sound an alarm. That silence becomes the danger. For adults older than 55, the situation becomes even more important because kidney performance naturally declines over time. This gradual reduction can begin as early as the 30s. By the 60s or 70s, kidney reserve capacity may already be significantly lower. That reduced reserve means the body has less ability to tolerate harmful exposures. Think of it this way. A younger person may have a full fuel tank and can afford waste. But with age, when the tank is already partly depleted, every decision matters far more. So what continues draining that reserve? One major threat begins not in the kitchen, but in the medicine cabinet. Picture a very common situation. Your knees ache after walking, your lower back becomes stiff. Arthritis worsens during cold weather. Like millions of people, you reach for a familiar over-the-counter medication, 1 or 2 tablets, maybe every day. Most people assume there is little risk because these products are sold everywhere without special restrictions. The label appears harmless. Pharmacies stock entire shelves with them. But regular use of non-steroidal anti-inflammatory drugs, known as NSAIDs, has become one of the most underestimated dangers to kidney health, especially among older adults. This category includes medications such as ibuprofen and naproxen, some of the most frequently used drugs in the world. Inside the kidneys are microscopic blood vessels responsible for filtration. Their healthy blood flow depends on signaling compounds called prostaglandins. These compounds act almost like traffic controllers, helping circulation move smoothly through the filtration network. NSAIDs reduce inflammation and pain by blocking prostaglandins throughout the body. That is why they work so effectively for sore joints and muscle discomfort. The problem is that the kidneys also rely on those same prostaglandins. When the signals are blocked, the tiny blood vessels constrict. Blood supply decreases. The kidney filters, known as nephrons, begin functioning under reduced oxygen conditions, similar to a city experiencing repeated power outages. A single dose after physical strain may not create permanent injury because the kidneys can recover. But repeated exposure day after day, month after month, or year after year changes the situation entirely. Over time, those repeated low oxygen episodes accumulate. Scar tissue develops. Once nephrons are destroyed, they do not regenerate. The loss becomes permanent. The individuals facing the highest danger include older adults, people with reduced kidney performance, those with high blood pressure, individuals living with diabetes, and patients already taking medications for blood pressure control because some drug combinations increase the damage significantly. A safer approach begins with speaking to a physician before using these medications regularly. Kidney function numbers matter, especially the GFR, or glomerular filtration rate. Knowing the baseline is critical. Other methods for chronic pain management may also reduce kidney strain. Physical therapy, controlled exercise, heat treatment, cold therapy. In some cases, acetaminophen used correctly may place less stress on the kidneys. Chronic pain is real and often exhausting. But pain control should never quietly evolve into long-term kidney destruction without a person realizing it. Creating a second problem while trying to fix the first is never a real answer. Threat number 3 is something many people never notice until much later. Dehydration that does not feel obvious. This surprises almost everyone because one of the biggest physical changes that comes with aging is rarely discussed openly. The body's thirst response becomes weaker over time. In younger adults, the process is simple. The body needs water, the brain sends a clear signal, thirst appears, and balance returns after drinking. But during the 60s and 70s, that internal warning system becomes much quieter. Sometimes the signal arrives late, sometimes it barely appears at all until dehydration has already become significant. This creates a hidden emergency for the kidneys. These organs require a constant and stable flow of fluid to function correctly. When dehydration develops, even mildly and consistently, that steady flow slows dramatically. Waste products in the bloodstream become more concentrated. The kidneys are forced to filter with less available fluid. Urine also becomes denser, increasing the likelihood of one of the most painful kidney conditions affecting older adults, kidney stones. But the danger extends beyond stones alone. Long-term mild dehydration places the kidneys under continuous low-level pressure. Over many years, that strain slowly reduces kidney performance. Eventually, laboratory results reveal declining function, yet there may be no single obvious cause. Only time, and too many days without enough water. The practical solution is straightforward. Stop depending entirely on thirst. By the time thirst appears, the body may already be behind on hydration. Instead, make water part of a routine. 1 glass immediately after waking up before coffee. Another with meals. 1 during the middle of the morning. 1 more in the middle of the afternoon. Pay attention to urine color. Pale straw yellow usually signals proper hydration. Darker shades often mean the body needs more water. Another important point should not be ignored. Coffee, tea, sugary beverages, and alcohol are not replacements for water. Some of them can actually increase fluid loss. Real hydration means plain water. Simple, essential, non-negotiable. It costs nothing, requires little effort, and may be one of the easiest ways to begin protecting kidney function immediately. Threat number 2 creates even more confusion because it hides behind something many people consider healthy. Protein. For years, people have heard the same message. Protein supports muscles, it improves recovery, it helps maintain energy. And all of that is true, especially for older adults dealing with age-related muscle loss known as sarcopenia. But one critical detail often receives far too little attention. Excessive protein intake, particularly from certain sources and in very large amounts, forces the kidneys to work much harder. Here is why. When the body processes protein, nitrogen-based waste products are created. The main one is called urea. The kidneys must remove urea from the bloodstream and eliminate it through urine. More protein intake means more urea production. More urea means more filtration work. In a young person with strong kidney function, this may not immediately create serious problems. But older adults already experience reduced kidney capacity with age. Anyone whose kidneys are already compromised faces even greater risk. Flooding the body with excessive protein becomes similar to asking an exhausted filtration facility to process twice the workload using only half the workforce. Medical research has become clear enough that even conservative guidelines recommend substantial protein reduction for individuals with chronic kidney disease. Still, this does not mean protein should disappear from the diet entirely. The key issue is choosing appropriate amounts and smarter sources. Plant-based proteins such as beans, lentils, and tofu are usually handled more gently by the kidneys than large daily portions of red meat or highly concentrated protein powders. The growing popularity of protein powders among older adults trying to preserve muscle mass has created another concern. Many people unknowingly place extra strain on kidney function without realizing it. Very few individuals need 200 grams of protein daily. The safest approach is working with a physician to determine what matches body weight and kidney condition appropriately. Testing matters, kidney numbers matter, and if protein shakes remain part of the routine, they should not become the only health conversation happening around kidney protection. Now comes the threat considered the most widespread, the least recognized, and perhaps the most deceptive of all. What makes it especially frustrating is that it often hides behind labels associated with health and nutrition. Words like natural, organic, heart-healthy, and clean. The issue is excessive dietary oxalate, especially from foods many health-conscious older adults consume daily while believing they are helping their bodies. Oxalates are naturally occurring compounds produced by plants as a defense mechanism. The human body also creates small amounts during normal metabolism. Under ordinary conditions, most dietary oxalate binds with calcium inside the digestive tract and exits harmlessly through stool. But when oxalate absorption becomes too high because of diet, gut microbiome imbalance, or reduced kidney clearance, the situation changes. The oxalate enters the bloodstream. Then the kidneys must process it. Once filtered into urine, oxalate strongly binds to calcium. When those two substances combine at the wrong concentration, crystals begin forming. Those crystals become calcium oxalate kidney stones, the most common kidney stone type by far, responsible for approximately 80% of all cases. But the stone itself is only part of the problem. That painful attack sending someone to the emergency room is merely the visible outcome. The most serious injury often begins long before a kidney stone ever appears. Tiny oxalate crystals, even at microscopic size, can settle directly into kidney tissue itself. Once there, they trigger inflammation in specific areas. Scar tissue begins forming. The tubules inside the kidneys, the narrow channels where filtration takes place, gradually become damaged. As the process continues over time, it contributes to a condition known as oxalate nephropathy, a pattern of slowly progressing kidney injury that often appears in laboratory results as unexplained decline. And the people consuming the largest amounts of high oxalate foods today are often health-conscious older adults. The reason is simple. Many foods highest in oxalates are constantly promoted as nutritional superfoods. Spinach sits near the top of the list. It is one of the highest oxalate foods regularly consumed by most people. Just 1 cup of cooked spinach contains more oxalate than many individuals should eat during an entire day. Almonds and almond-based products have also become common pantry staples. Almond milk, almond flour, almond butter, and whole almonds all contain exceptionally high oxalate levels. Beets are another major source, whether raw, roasted, or juiced. Sweet potatoes, Swiss chard, rhubarb, dark chocolate, cocoa powder, and certain varieties of instant oatmeal also belong on the list. That does not mean these foods are automatically dangerous in every circumstance. For someone with healthy kidneys, proper hydration, and a balanced diet, they may still fit into a healthy eating pattern. But for adults over 60, people with a history of kidney stones, individuals already experiencing reduced kidney performance, or anyone eating large amounts of these foods daily for many years, the cumulative oxalate burden may quietly contribute to serious kidney problems without anyone connecting it to declining lab numbers. This is one of the most troubling realities in preventive medicine. Many people believed they were making excellent health decisions. They followed nutrition advice. They purchased organic spinach, almond milk, and dark chocolate because they thought those choices supported long-term wellness. Yet for their specific condition, some of those habits may have been working against kidney health instead. The solution is not fear. The solution is awareness and smarter decisions. The first strategy is choosing variety instead of repetition. Eating a spinach smoothie. 7 days each week creates a completely different exposure compared to eating spinach only twice weekly. Rotate foods more often. Kale contains far less oxalate. Arugula, romaine lettuce, and cabbage also provide strong alternatives. Spinach does not need to disappear entirely. It simply should not become the only vegetable constantly consumed. The second strategy is pairing high oxalate foods with calcium-rich foods during the same meal. This point is extremely important and rarely discussed enough. Calcium can bind with oxalate inside the digestive tract before absorption occurs. Instead of entering the bloodstream and reaching the kidneys, the oxalate exits the body through stool. That is why older advice telling people with kidney stones to avoid dairy products often turned out to be incorrect. A spinach salad combined with cheese or milk creates a different outcome than spinach alone. Dark chocolate eaten alongside yogurt changes absorption patterns as well. Food timing and pairing matter tremendously. The third strategy is aggressive hydration. Water helps dilute urinary oxalate concentration, lowering the chance that crystals will form. Urine should remain pale rather than dark. That simple observation acts as a daily at-home indicator of kidney health and costs absolutely nothing. The fourth strategy is testing kidney function regularly. Anyone over 55 should know their GFR, glomerular filtration rate, along with urine albumin levels. These are routine blood and urine evaluations. They provide a baseline and reveal the actual condition of the kidneys rather than assumptions. Knowledge protects health in ways no supplement can replace. The fifth strategy involves reevaluating supplements carefully. Very high doses of vitamin C above 1,000 mg per day convert into oxalate inside the body. Many older adults take large vitamin C doses believing the practice is harmless or beneficial. Anyone consuming more than 500 mg daily should discuss kidney health with a physician before continuing long-term. The same principle applies to the other kidney threats discussed earlier. Consult a doctor before relying regularly on NSAIDs. Drink water before thirst develops. If protein supplements are part of the diet, understand the quantities being consumed and monitor kidney numbers consistently. At this very moment, the kidneys are still working continuously, filtering, balancing, protecting the body every second. For 60, 70, or even 80 years, they continue performing these tasks quietly, without demanding attention. What they deserve in return is awareness. The threats discussed here, overused pain medications, unnoticed dehydration, excessive protein intake, and high oxalate exposure disguised as healthy eating, are not unavoidable. Vegetables can be rotated. Meals can be paired more intelligently. Water intake can improve. Simple blood tests can reveal problems early. None of these changes appear dramatic overnight, but over months and years, small adjustments accumulate into something powerful. A healthier body, greater independence, better function throughout the 70s, 80s, and beyond. That is the purpose of preventive medicine. Acting before crisis arrives instead of reacting afterward. If this information changed the way you think about kidney health, pass it along to someone close to you. A friend, a sibling, a spouse who may be following habits they believe are completely harmless. Sometimes one conversation can completely alter the direction of a person's future health. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.